Welcome to committee.
Good morning, everyone. Happy lame duck. So Chair Manchester, Vice Chair Catrona, Ranking Member Denson, and member of the House Families and Aging Committee, thank you for having me today. My name is Kathryn Poe. I'm the Public Policy Manager at Equality Ohio, and I use they, them pronouns. Just like all of you today, I too have listened to hours of testimony on this bill and taken the time to read the statements and presented research from opponents. It's clear to me that supporters of HB 454 have two main arguments. One, that young people are simply too immature to make these kinds of life-changing medical decisions. And two, that practices and medications used in gender-affirming care are dangerous, understudied, and at times irreversibly damaging. But today, I'd like to share my personal story about why I know that this bill is just completely unfounded by placing the issue back within the broader context of pediatric medicine. So I didn't have a typical young adult life. I spent much of my teen years living in pediatric hospitals fighting a rare life-threatening blood disease that required intense treatment, including consenting to chemotherapy and complex medications as a minor. Ultimately, I was given a life-saving bone marrow transplant. There are many people in this room that know this about my story. So if anyone in this room understands what it's like to consent to irreversible, life-altering medical procedures as a minor, it's me. My treatment required years of off-label use of drugs, mental health treatment, hormones fertility treatment, and difficult discussions about my life as a minor. Today, I live with the effects of the medical decisions that I made at 16. Now, I do not believe that the stories of transgender youth and their families within our medical system are any different than mine. In fact, I've often been surprised by just how much I resonated with their patient experiences and just how similar our experiences with life-saving medical care are. Now, I do understand that when we say that this care is life-saving, we need to specify what exactly we mean. Medical care is a long series of ongoing decisions. There are lots of personal decisions built into what we consider to be life-saving for any one person. It is not just a single moment in time, but it is a progressive, ongoing of medical treatment. In my case, it was the option to pursue treatments with my parents that I wanted on my own terms, frequently just to improve my quality of life, not even necessarily to save it. Not all life-saving treatments are literally life or death, like my bone marrow transplant. I don't think we often consider just how much quality of life can affect a person in these situations. And many choices that my parents and I made, even for a rare illness, were focused on my quality of life and my perception of myself. Those too were life-saving decisions. And in many of these choices, these were my decisions with the support of my family. And I made them responsibly. Even as a minor, I took those situations seriously because it was my life. And transgender youth and their families are no different. They are collectively making life-affirming, life-saving decisions together at one time with the advice and support of a holistic medical and mental health team. Many people want you to believe that gender-affirming care is abnormal, and yet within the scope of larger medical care, this simply isn't the case. Take it from someone who literally grew up in pediatric hospitals for months at a time. Off-label use of medication is common. It's estimated that up to 20% of all medications prescribed for indicators that are not approved by the FDA. And these estimates increase when a specific condition or need is smaller in the general population and a patient is medically complex. For example, Lupron, which works by stimulating the body's own production of certain hormones, causing them to shut down temporarily, has come up in these hearings as dangerous, scary. But in reality, it's common medical practice for minors going through various kinds of chemo and even endometriosis in women and girls. I would know. I was put on Lupron as a minor, and that's also why I know it's reversible. Lupron wears off after a couple of months and needs to be re-administered. And while the medication does carry risks and side effects, I would argue that they are not exceedingly abnormal in the course of regular treatment. Everyone's body reacts differently to medicine, but these are not mysterious, unknowable drugs. And I know that there's been a sub-bill introduced today. I want to speak to that for a moment. As someone who's been within this medical system, I can attest to the fact that adding additional barriers does not help anyone. These are not unknowable drugs, and we have to trust our doctors and pediatricians, the people that saved my life, in order to let them just do their jobs. We know what these drugs are. We know what they do. They're not that scary. And in the course of normal medicine, they are life-saving opportunities for these young people. Patients like me and the broader public also have other reasons to be concerned about this bill. I'm concerned at any mention of removing state funding from our pediatric institutions, when what we know goes on there is equally as life-saving as this gender-affirming care. All over our state, young people, with the help of their families, many of which are in this room today and in all of the hallways waiting to be heard by this committee, those families make serious medical decisions about their bodies every day. We know that the ideas that family can't make hard choices is false, insulting to Ohio families. We also know that these treatments and medications being demonized are safe because they're used broadly. In other contexts, this is normal, safe, fact-based, actually really very boring healthcare. And everyone in Ohio deserves access to healthcare, just like me, for any reason. I will now take questions.
Thank you, Kathryn. Are there any questions for the witness? Representative Click.
Thank you, Ms. Poe, through the chair, for your testimony. And I accept responsibility for this because I did not mention it in the sub-bill, but this -9 version does no longer remove state funding from institutions. So I just want to clarify that.
Thank you so much for that. We do appreciate that. I do have to say that the fact that the original version of the bill included it at all is still very concerning. Like, I really want to kind of drive home what the outlandish, effect of something like this would be. The fact that we would go over our pediatric institutions that save children's lives every single day over something like this is deeply concerning. So I'm very glad that you took it out of the bill.
Representative Humphrey.
Thank you, Madam Chairwoman. And thank you, Kathryn, for being here. It's so nice to see you. But just want to ask on a personal note. So do you personally believe the unavailability of affirming care and services, stigma, harassment, and other forms of rejection may seem to lead to adverse outcomes in terms of like mental health, physical health, and beyond?
Oh, absolutely. I mean, and I really want to place this bill within the broader context of medicine, because I think it's important how we do this in other situations and realize that this isn't abnormal, right? So imagine taking your child to the doctor, and while you are there, the doctor informs you that your child may have a mood disorder, right? That's a very common thing to happen within pediatric medicine. And then suddenly to be told right there in the pediatric office that you cannot access healthcare for your child. Imagine how traumatic that would be. I mean, I myself have experienced healthcare denials. I know what that feels like. I know how harmful and terrible it is for your mental health. My family and I have cried over a lack of treatments together for years. I cannot imagine what it would be like for these families to find out that their child cannot access any care at all. This bill is so wildly extreme. I don't think that there's a country anywhere in the world that bans gender-affirming care like this bill bans gender-affirming care. And so, gender-affirming care is life-saving. To ban that, to say that kids can't access it, it's truly heartbreaking.
Follow-up?
Thank you. I'll be quick, Madam Chairwoman, so thank you. And then to Kathryn, the follow-up to that is even if children were put on like a wait period to have to wait 2 years or something like that, you still see that even if it's a wait to kind of go through, you see that as being a barrier. Is that correct?
Oh, absolutely. And again, there's no other kind of healthcare where we would require someone to be put on a wait list, right? If you go into the emergency room and you say, hey, my knee's broken, yeah, we'll get to you in 2 years. Are you kidding me? No other kind of healthcare requires you to wait this long. And honestly, if you're trans in Ohio right now, you already know that there is already a wait list at many of these hospitals to get this kind of care. People are literally being turned away at the door already because they already can't access it. So unfortunately, the system has created this problem. However, adding another 2 years with these kids doing what? Where are they supposed to go? If they have banned mental health care resources, what are they supposed to do during that time? What are their families supposed to do? Who are they supposed to ask? You know, that's what happens during a 2-year wait period. And it's sad because, like, we want to give resources to these families, and those resources already exist. And the best option is actually to expand them.
Are there any additional questions for the witness? Seeing none, thank you very much for your time, Kathryn. I would like